challenging for the patient, actual disease plus side effects of the steroids. I am a homeopath by choice.
It's not a placebo. How can you make people believe that it has got science behind it?
Homeopathy is as effective as in acutes, up to the chronics, even in autoimmune diseases. Homeopathy is basically based on the principle of patients with the same disease. As their bodies are different, they might react or they respond to the disease in different ways. So the studies and meta-analysis that shows positive clinical effects.
How can homeopathy help cancer patients?
In layman language, we can say a perfect matching remedy.
Medicine तो इतने diluted होते हैं. I mean, they are how can those sweet pills be effective?
General drug. The general drug acts chemically, but homeopathic medicine does not act chemically.
Namaskar and welcome to Audio Voices with Sangita. Today, I'd like to talk a little bit about my journey as a patient of autoimmune disease SLE, which is a life threatening disease. In 1985, I was diagnosed with SLE. What helped me? Homeopathy. I have shared my journey in my book, Light Beyond the Shadows, a true story, where I have mentioned how faith and alternate medicine can help. So today I bring to you Dr. Akshata, an homeopath, who will explain to us the science behind homeopathy. She is a practicing homeopath for the last 8 years. What makes Dr. Akshata unique is her background in critical care at leading hospitals like Ruby Hall Clinic and KEM Hospital, combined with her expertise in homeopathy, nutrition, and clinical cosmetology. Her mission is simple yet powerful: to make homeopathy accessible, trustworthy, and effective for every family in Pune. To the podcast, Dr. Akshata, can you tell us a little about your journey into medicine and what inspired you to choose homeopathy?
So basically, since childhood, it was my dream to become a doctor. So the small things regarding this field, like doctors, their aura, literally the aprons, stethoscope, these things used to fascinate me a lot. I remember when I was in my secondary high school, the neighbor of mine, she was studying in medicine faculty. So I used to go to her place and literally used to see her books for hours. So when I was in secondary high school, I knew the all book names of medicine faculty like Gray's Anatomy, BD Chaurasia, Davidson, like that. So yeah, by that time, my family and I came to know, yes, I have interest in this field and I can pursue a career in this field. So my mom took me to the practitioners in our locality for the guidance purpose. So approximately, you won't believe, 60 to 70% doctors advise me to go for a homeopathy, saying that homeopathy has a very bright future in coming days. Today, I can proudly say that I'm a homeopath by choice.
But people do not have much faith in alternate medicine, and there are many skeptics. I mean, they do not. So, for those people who do not have much understanding of this particular form of medicine, can you please tell them what are the formal qualifications required to be a homeopath? What training do you take?
So, to become a homeopath, the degree which is needed is BHMS, that is Bachelor in Homeopathic Medicine and Surgery. It is a degree course of 5.5 years, divided into 4.5 years of academics and 1 year of internship. So, to practice homeopathy, you need this degree and registration. After the BHMS course, many doctors pursue for post graduation or specialization. But here I want to add something which is very interesting. Only the BHMS degree is not enough, or only the degree, whatever may be the degree, it is not enough to practice. The proper training with that course and clinical experience is very, very important. Because until and unless I feel you don't have proper clinical knowledge, you cannot be a good clinician. So yeah, in India, basically BHMS degree is required to practice homeopathy.
So you have to basically study medicine like how it is in the other uh, field. I mean,
Yes, exactly. We have
Mm.
the same, yes, yes. We have the same academics like any other faculty. We have medicine subject, we have anatomy, physiology, then the posology thing, the homeopathic materia medica. Only the thing which is different, only the subject which is different in homeopathy, that is homeopathic materia medica. Other, all the subjects are same. Anatomy, pathology, physiology, then your medicine, surgery, all the subjects are same.
Basically, you study as much as an MBBS doctor.
Do as the
Yeah,
BAM students do,
correct.
it is all the same. The whole academic part is the same except the materia medica thing. The MBBS students studies pharmacology, BAMS में होता है their Ayurveda, and BHMS में होता है the materia medica thing. Only this part is different.
Only that part
Baki everything
is
is
the same.
academics, even the internship part also.
So homeopathy has been practiced for more than 2 centuries. Could you explain the basic
Yes.
scientific principle behind homeopathy, how it works?
This is very important question, I feel. So homeopathy is basically founded by Dr. Samuel Hahnemann in 18th century. Okay, this homeopathy is basically based on the principle of similia similibus curant. That is, like cures like. You must have heard about this terminology many times. The like cures like. मराठी मध्ये आपण ज्याला म्हणतो काट्याने काटा काढायचा.
Hmm.
So what this actually is? So the science behind this is a substance which can produce certain set of symptoms in healthy individual when that same substance in diluted and potentized form given to the patient who is having same similar set of symptom, it treats those symptoms.
Okay.
So this is the principle behind this homeopathy, that like cures like. And I would like to give an example of this. In homeopathy, we have one medicine, Allium cepa. And why I'm giving this example, it will become easy to everyone to understand. The Allium cepa is the medicine. It is prepared from the raw onion. We all know the raw onion. What it can do, it produces the symptoms like watering from eyes, burning in your eyes, some nasal discharge. So this raw onion, when diluted and potentized, it becomes a medicine that is Allium cepa. And this Allium cepa, when given to the patient having same symptoms like watering from their eyes, runny nose, burning sensation in eyes, this Allium cepa treats those symptoms. So this is how homeopathy works. So, and I would like to add one more point to the who all are seeing this video. If you have cold and watering from eyes, don't take Allium cepa. Homeopathy is just not limited to this. The basic science behind this lies in the law of individualization. So, what is this individualization? We consider the patient as a whole and not just the disease. For example, if we have two patients with the same disease, as their bodies are different, they might react or they respond to the disease in different way. For example, one might present with the getting worse at night, craves for sweets, and becomes very anxious during the illness. Another one might feel worse in the morning, prefers warm drinks, and becomes irritable during the illness. So, as the patient is responding to the disease in different manner, their medicine will be different. In homeopathy, we study all this pattern of the disease which is patient showing. And the remedy chosen, the remedy given is matching to the patient symptoms. So basically, homeopathy studies all these patterns, what is patient is showing during the illness. And the remedy chosen, it is matching, perfectly matching to the patient symptoms. So the perfect remedy, the perfect matching remedy to the totality of symptom of the patient, the faster the recovery is. So yeah, this is all about the principles behind the homeopathy and science behind the homeopathy.
So I have been taking homeopathy for the longest time ever. In 1985, I was diagnosed with SLE, lupus, which is a life-threatening autoimmune disease. So I took homeopathy for that.
Autoimmune.
Yeah, and when that was the first time I ever, went to a homeopath, and the questions they were asking me, I was like, what has this got to do with my, issue? To let you like
How does it
cold or you
relate
like
to my
hot or
illness?
you like, yeah, there were whether you like spicy food or whether you like, there were some very
Yes.
questions which seemed irrelevant to me at that time, but for that my issue, I was being asked to take steroids, and steroids, as you know, is very harmful. So
Yes.
yeah, so
See,
that helped me.
when it comes to autoimmune disease, you have the conventional in conventional medicine, they starts with the steroids, and it becomes very challenging for the patient.
Yeah.
Actual disease plus side effects of the steroids. You were saying
That is why I even wrote a book, because to share my journey and how alternate medicine has
okay.
helped me. I wrote a book to share that, because I have seen that many people they think homeopathy is just a placebo. So how can you, make them understand? Is there any way you can say, okay, it's not a placebo? How can you make people believe that it has got science behind it? What would you say?
This is a very valid question, I must say. And it's very important to address this question scientifically, I feel. So, uh, some large reviews have concluded that the evidence for homeopathy is not consistently strong beyond placebo. However, I would like to say, however, at the same time, there are also the studies and meta-analysis that shows positive clinical effects, especially when it comes to chronic diseases. Although this remains the area of ongoing research, of course, but we have to understand this. The scientific picture is not completely one sided, it is still evolving, right? So, from clinical perspective, also, we do see the consistent pattern of improvement, particularly in individualized treatment, which is the key aspect of homeopathy. So it is not a placebo. It has got a proper studies, research, and scientific evidences behind it.
So, how does a homeopathic consultation differ from a typical consultation in conventional medicine?
Yes. So in conventional medicine, it is like mathematics. This is equals to this. In conventional medicine, we treat symptomatically. But in homeopathy, we consider the patient as a whole and not just the disease. As I said earlier, we do not look only up to the disease. We consider the patient as a whole. So, as also you have the experience, the homeopaths take very long history. Along with your main symptoms, we do consider any associated complaints are there. When does it get worse? When do you feel relieved? Then again, the physical generals like uh, your appetite, your thirst, your thermals, then your cravings, your aversions, what things you like to eat, what you do not like at all, your sleep pattern, then your mental plane, how is your emotional status, any fears you have, any stress factors are there, along with all the personal history, any family history, we have to look for the genetics also. Then the any other past medications or medical history. So we consider each and everything. We make a totality of symptoms, and depending upon those symptoms, we select a simillimum medicine. That is, in short, in layman language, we can say it a perfect matching remedy.
It's very important actually. Supposing if a patient is not clear, I mean, when you ask these questions, when you are asking all these things, and the patient is not giving you the correct replies, can it affect the treatment? Can it affect what, your decision on how to treat the patient, what medicine to give? Just a question.
No, I will tell you that I think only five things are necessary. The thermals, the cravings, the any stress factors are there. Not always this long history is required. We think homeopathy is only effective in chronic diseases, but it is not the case. Even in acute diseases, we prescribe like cold, cough, fever. You cannot take such a long history in acute diseases also. You have cold and cough and you are giving me half an hour history, so it is not possible. It will be very irritating for the patient also. So it is not the thing always require that much of long history. Even the presenting on the basis of presenting symptoms, yes, we can treat, especially if it is acute, when it comes to acute complaints.
One doubt everybody has in the mind is that homeopathy medicine तो इतने diluted होते हैं. I mean, they are how can those sweet pills be effective? How can those small doses be effective? What do you have to say to those people?
Another very interesting and important question, a very biggest myth. Homeopathic medicines are diluted, so how can they work? Yes, in homeopathy, our medicines are highly diluted because they aren't meant to work like a general drug. The general drug acts chemically, but homeopathic medicine does not act chemically. it it is not meant to work like that. Okay? Instead, homeopathy works more like a signal or trigger to the human body. If the right medicine is selected for the patient, even in very small amount it is given, it can help the body to activate its own healing mechanism, its own healing response. So, in simple terms, it's not about how much medicine you give. It's all about how well matched medicine you're giving to the patient.
Okay.
If it is perfect matching remedy, even if it is given in small amount, it can treat the patient.
Here, I would like to share again that for nearly 30 years, I had been suffering from vertigo, severe vertigo. And when I came to Pune, somebody advised me to go to a homeopath in Mumbai, and I went there, and she gave me medicine. And believe me, 30 years of severe vertigo in 3 months. For next, I think 7-8 years till my diagnosis of brain tumor, I had no episodes of vertigo. So, I mean, so I have so much faith in homeopathy, and I'm always trying to convince people of that. And I'm
Glad to
taking
hear
so
that.
many medicines, Tujuron, Vortin, Stemitil, and it would be so bad for me. So, yeah, I mean, yes, people need to have more faith
Need to
in homeopathy.
understand.
I would also like to know there are certain health issues which are for which homeopathy is more effective.
I feel homeopathy is as effective as in acutes, up to the chronics, even in autoimmune diseases, and even when it comes to a supportive palliative care in cancer patient also. It is not like only this kind of diseases are get treated or get relief or heal. Acutes, as I said, cold, cough, fever, in children cases where the very low immunity, recurrent cold cough, teething issues, tonsillitis, adenoids, where surgical intervention is usually advised. But we can avoid those surgical interventions only with this homeopathic treatment. Again, in chronic diseases like thyroid issues, then arthritis, even PCOD, skin problems like psoriasis, eczema, even hair problems like hair fall, alopecia, even if it is chronic, if it is hereditary, yes, we can treat it very well. Piles, fissure, fistula, again, where in conventional practice, the surgical intervention is needed. We can treat it with the homeopathy very well. Then even in sleep issues like insomnia, anxiety, depression, and all the aspect, homeopathy works very well. Even in autism cases, ADHD cases, homeopathy works very well and help to the patient, especially to the parents who's having ADHD and autistic child. Homeopathy is a hope for those parents.
Okay. That's really wonderful. I didn't know there were so many areas in which homeopathy could help. Yes. So, are there any significant patient stories that you can share where you saw the change happening with homeopathy treatment?
Yes, yes. There are actually many stories, but I would like to share one case of ASD with ADHD. ASD is autism spectrum disorder. This is the case of 6 years old twin brothers. So they presented with the complaints of hyperactivity, the destructive behavior, then cognitive and sensory issues, which we see in the ASD cases, then zero eye contact, no sitting time, then sleeping issues. Uh, the kids with the age of 6 years, they could not get admission into the school because of their destructive behavior and hyperactivity, and they do not used to follow any of the command. Like, and sitting time was zero. Also, one more striking peculiar symptom was there. The kids was not used to sleep before 2 to 3 a.m. So this was the very challenging. All the symptoms were very challenging to the parents. So just after starting the homeopathic treatment, just after 2 days, parents had come just to meet, and the mother entered to my room and she was literally crying out of happiness because her kid slept by 10 p.m. in the night on the very first day of receiving homeopathic medicine. Already the patient with ASD, it becomes very challenging for their parents to deal with all those symptoms and deal with all the milestones of the kids. So that that day the parents were so happy कि मैडम मेरा बच्चा 5-6 महीने से 2-3 बजे से पहले सोते ही नहीं थे, वो फर्स्ट डोज में ही 10 बजे सो गए.
So,
After 15 days of their follow-up, the sleep cycle were regularized. They were sleeping very properly on time. The sleep cycle had improved. They started eye contact. The eye contact was improved slightly. This was the improvement just within 15 days of homeopathic treatment. After 3 to 4 months, the kids' hyperactivity was reduced, eye contact were improved, the sitting time at least improved with 1 or 1.5 hour or so. जो बच्चों को 2 साल से किसी भी स्कूल में एडमिशन नहीं मिल रहा था बिकॉज ऑफ देयर हाइपर एक्टिविटी, डिस्ट्रक्टिव बिहेवियर, नो आई कॉन्टैक्ट, not listening to anybody, just running here and there, they got admission in the school.
that's awesome.
Yeah. So this is what homeopathy can do even in ASD cases. Homeopathy can be a hope for those parents who are handling the ASD or ADHD kids.
Mhm. That's wonderful. That's wonderful, Dr. Akshata. Uh, I'm sure it must have been a big relief to the parents to have
Yes,
kids
yes,
with
yes.
that ailment. Dr. Akshata, you also have experience in critical care at hospitals like Ruby Hall Clinic and KM Hospital. So, how does that, in which way does that experience help you in your treatment as a homeopath?
I worked in emergency department in Ruby Hall Clinic and in ICU in KM Hospital, Pune. So since the beginning, my motto and the final destination was always homeopathy. I worked in the hospital for my clinical experience. So this combination of the modern medicine and the natural healing approaches, this combination helps me while treating the patient. In addition to this, I have pursued some additional qualification also, that is PGDMS, post graduation diploma in emergency medical services from Ruby Hall itself. After that course only I entered into the emergency department of Ruby Hall. Then DDHN, Dietetics and Health Nutrition Diploma course, and PGDCC, that is post graduation in clinical cosmetology. So since the beginning, I wanted that, or somewhere it was my dream. Whenever I'll practice, I want to give the holistic solution to my patients. So whatever was needed, the background, whatever was needed for that holistic solutions, I created that.
That's awesome.
With the
That's
help
awesome.
of,
Yeah,
yeah,
you mean to say you can give dietary advice also if there is
yes,
you are because you understand those things also. But you give only
exactly.
homeopathy medicine, correct?
Yes, yes, yes. I do practice only homeopathy.
Mm.
See, I want people to understand na, कि healing is not only about the medicine. Whichever faculty or whichever medicine you choose, be it a conventional, be it a allopathy or Ayurveda, healing is all about not only about the medicine. It is all about your lifestyle, your nutrition, your emotional well-being, and body's natural ability to recover from it.
Very true. Very true.
I focus on the lifestyle management along with the homeopathy.
Very, very true. And I'm sure that must be helping. So, in today's fast-paced lifestyle, many people, struggle with stress-related issues. So, how can homeopathy help these people?
Homeopathy helps very well in all the stress related issues, the diseases which are caused because of the stress. Like in today's world, the lifestyle disorders are increasing day by day. It is because of your stress, the faulty lifestyle. When we call a lifestyle, many patients ask, "Ma'am, आप बोलते हो lifestyle ठीक करो lifestyle." Exactly what lifestyle means? The lifestyle means your diet, your sleeping pattern, your sleep cycle. Then third is your water intake. Fourth is exercise. Fifth is the stress related factors. And sixth is habits. So whenever it comes to faulty lifestyle, disease is going to come. So in the stress issues also, like let it be a anxiety, depression, or sleeping issues, we call it a insomnia. Homeopathy works very well. Even I have one example. Patient had come up for the PCOD treatment, but she had very severe overthinking, chronic overthinking, insomnia, then obesity along with that, dietary complaints was there, gastric complaints was there.
Mm.
So in that case, when she received the homeopathic medicine, the first thing which was corrected, it was her sleep, her stress factors, her
Mm.
anxiety, her overthinking. So
Mm.
it is all connected.
Dr. Akshata, I'd like to know that how can homeopathy help cancer patients in which way, like in controlling the side effects of the
Yes.
treatment? How can it help them?
First thing is homeopathy is not replacement for the conventional methods or conventional treatment to the cancer, but it can be helpful in controlling the side effects. It can be helpful as a supportive medicine. For example, while going through the all conventional therapies like chemotherapy, radiation, and even after surgery, patient suffers from lot many side effects like nausea, fatigue, very severe weakness, then sleep issues, anxiety issues. Then after radiation, some people get the skin reaction, allergies, redness, pain. In all these cases, homeopathy can help very well by reducing the symptom and increasing the good quality of life. It can act as a very strong supportive treatment in all those cases. Main motto with the help in cancer patients, main motto of using homeopathy treatment is to improve patients' overall well-being.
Mm.
Because when we say common side effects, it is common for science, but the patient who all are suffering from that, it becomes very challenging and very troublesome for them to experience it on daily basis. This is where homeopathy comes into the picture and help the patient very well.
Mm.
It is not slow, it is effective and fast when the correct medicine has been given. Only when in chronic diseases, we cannot expect the 10 years of disease will get cured just in 1 month. So there are some factors we have to consider in chronic cases, but it gives a
Effects are also minimum, right? Or there are no side effects at all.
I would not say no side effects at all. If there are effects, there are side effects also. But that is why no one should self-medicate. They should go to a nearby homeopath and take the homeopathic medicines.
Okay.
But there are very minimal side effects because the medicine is in potentized form. It is not in crude chemical dose, which we discussed earlier. As it is not in the chemical form, the side effects are very, very, very minimal.
Thank you, Dr. Akshata, for sharing your knowledge and insights on homeopathy and the science behind homeopathy. I'm sure people are going to now understand that this is not a placebo and that it can help, actually help, and it does help. Even I have a proof of that because I truly believe in homeopathy. So thank you so much for coming here. It was really my honor to have you here. To my viewers, if you found this episode valuable, please do like, share, comment, and subscribe. Until next time, stay strong, stay healthy. Goodbye.